Viper. These hands are clean. Hi, Aubrey. I'm a student physical therapist assistant. How are you doing today?
I'm good.
Okay, good. I'm glad to hear that. Now, I noticed you had a surgical repair of your Achilles. Could you tell me how that's doing, if you're having pain on that, and where that pain is at?
Yeah, I'm having a little bit of pain, like just throughout here.
Okay. Now, that pain, if we had to rate it on a scale from 0 being zero pain, no pain, and 10 being extreme pain, what would you rate that pain today?
I say it's about a 2.
A 2? Okay. So it's definitely there. Hopefully we can decrease it and get you back to walking normally and loosen it up and strengthen it as well.
Okay.
So what I have planned for today, actually I want to start with some ultrasound. And what this does is it really can heat up that tissue and allow it to stretch more. And so it should help your performance throughout our treatment of being able to stretch very well and also be able to use that muscle really good. Does that sound like something you're good with?
Mm-hmm.
Okay. Before we do any ultrasound on you, I want to ask a few questions just about you so we know if you're a good candidate for this. Do you have any internal electrical devices, possibly such as a pacemaker?
No.
Have you ever, do you have or know if you have a blood clot in that area?
No.
No? Okay, great. And have you ever had a joint replacement in that area?
No.
Okay, sweet. And are you seeing a physician for any big medical problems, possibly cancer?
Mm-hmm.
No? Okay, I think you're a great candidate, and I think this is going to really help you.
Okay.
And so, what it's going to do is it's going to heat up. It's going to feel generally warm, okay? And we're going to do it for about 20 minutes, and so that's kind of what you can expect for this treatment. If you could lay down, and there's a little face pillow here for you,
Okay.
and I'm going to have this under your belly just to be comfortable.
Okay.
Oh yeah, thank you for taking off your shoes.
Yeah.
Okay, are you comfortable there?
Yes.
Okay, good deal. Now, Aubrey, I'm going to apply some ultrasound gel to the back of your Achilles here,
Okay.
kind of where it hurts. Okay, we're going to get started here. It may take a little bit to feel like it's heating up.
Okay.
Okay. Do you feel any warmness yet?
I don't know, a little bit.
Okay. Yeah, it may take a little bit, about 3 minutes. You comfortable?
Mm-hmm.
Okay, good deal. Got about 30 more seconds. I know it's probably hard starting off with this, and then we're gonna have to do exercises, but this will be good to help you perform a little better in the exercises and decrease that pain. Okay, it looks like we're good here. Get it all dried off. Your skin looks good. Looks like it handled that really well. Give me just a second and we'll get you set back up. Stay comfortable right there. Put your sock back on. That's good. Okay, we can get you set back up here. How did that feel?
So pretty good.
Okay, great. So, what I would like for us to do now is if I can get your shoes put back on, we're going to stand up. Okay. Now I have this just for safety. I know you can walk pretty comfortably, but I just want to put it on you for safety. It's going to be around your belly button area, just for safety.
Okay.
So, do you have any incisions, like a belly button piercing, or any colostomy bags possibly in that area?
No, I don't.
Okay, great. I'll put this on you. Okay. So if you can go ahead and stand up, we're going to come right here to the wall, and I want you to put both your hands on the wall and put your right leg back.
Okay.
And keep it straight and kind of just lean into the wall. You should feel it right about here. Is that where you feel it? Okay, it should be stretching that. Okay, we're going to hold that for 15 seconds. Okay, relax. And then we're going to kind of shake it out, and then we're going to do that again for 15 seconds.
Okay.
You still feel it right there in that same spot?
Yes.
Okay, great. Perfect, 15 seconds. So for this next one, it's going to be in the exact same position, except bend your right knee there, and it should, yeah, you should feel it a little lower this time. Okay? I'm going to stretch that calf. Do you feel it lower, kind of down here? Okay, perfect. We're going to hold that for 15 seconds.
Okay, well, I'm here to help you today. So the first one would be, so you can't bend forward or bring your legs up towards you. So you want to keep at least a 90-degree angle. So your body can't move like this, either like this or this. So, bending forward.
Okay, perfect.
Bringing your legs up.
Relax.
Okay.
And we'll do that again
Okay.
for 15 seconds. Make sure to bend your back knee there.
Is, like turning your toes in or like pigeon toeing.
You feel it down here?
Okay,
Okay, perfect.
Toes point straight up to the ceiling. So when you're turning.
Okay, 15. Great job. Okay, for this next stretch, I want to come over here to these steps, and we're actually just going to stand on this first step and hang your heels, both heels off, and just relax for 15 seconds. I'm actually going to grab a hold of this belt back here just for safety. You just hang them off. Yep, you feel that stretch? Okay, perfect. Hold that for 15.
Otherwise, you could pop your hip out of place. You don't want to ruin your new hip. Okay.
Okay, you can step back up and kind of relax. And we'll go back to it for 15 seconds. And then we'll be done stretching, I promise.
You can hold it for like 1 second. Squeeze your bottom. Let go. Okay, does that make sense? Yes. Yep. Perfect. And we're going to do 10 of those.
Okay,
Go ahead and
15.
count for me.
Great job. Just step back down. Awesome. Okay, if you want to come back over to the bed, or plank, whatever it is called. What I have planned now is now I want to strengthen that same muscle we've been stretching. Okay. So if you could stick your feet out here, you can leave your shoes on. It's okay. And what we're gonna do is I'm gonna wrap this around. If you could hold on to both of those. I want you to imagine you're stepping on the gas pedal with this foot here. Yeah. I want you to do that 10 times. And could you count for me? Great. Nice and controlled.
4, 5, 6, 7, 8, 9,
One more. 10. Great job. Okay, I'll take this. We're done with that guy. Now if you want to come to the edge of your seat here and hang your feet down to where they touch flat. And now what I want you to do is just the same motion. Pick your heels up as high as you can, yeah, and then slowly lower them back down. 3, 4, 5, 6, 7, 8, 9, 10, and we'll stop there. We just want to do 10 of those. And for this last one, if you could stand up, just right there is fine. And then just that same motion, we're going to stand up with both ankles, okay? 1, 2, we'll do 10 of these. 3, 4, 5, 6, 7, oh, I'm doing them with you, I didn't even realize. 8, 9, 10. Amazing job.
Thank you.
Okay, you can go ahead and sit back down right there. That's fine. I'll actually just take this back off for you. We don't need it anymore.
Maybe 10 of those as well.
So everything we did today is something we can obviously do here in therapy, but at home, I really would like for you to be able to work on some of these.
Mm-hmm.
So you remember the wall stretches we were doing? You feel like you can do those at home pretty well?
Mm-hmm.
Okay. And you remember how to do them and where you felt it?
Yes.
Okay. If you could do those, I think that's going to really help you decrease your pain and start improving your recovery process really fast.
Mm-hmm.
And then also, just this one right here, that strengthening one, I think that's a really easy one. You could do it, I don't know if you have an office job or whatever, you can do it at work. I mean, you can do it at home, wherever you are.
Mm-hmm.
And it's not, you did it really easy. So I think you could do that like throughout the day, a couple times a day. Do you think you could do that?
Yeah.
Awesome. Yeah, I think you can too. So now that we've got that covered, back to your pain, on a scale from 0 to 10, that same scale we talked about. I know it was a 2 before. Where is it at right now?
I would say it's at a 0 now.
Oh wow! Yes, that's awesome. So 0 out of 10. That's what we're looking for. Hopefully we can do that all the time and get you back to normal. So we'll do some more later. Thanks.
All right, thank you.
Yep.